This image is interesting because it is just a fiction which is carried out by which allows you to think. You see, if you increase the polyphenols, you see the curve that was done? We have explorated in regards to the risks of heart problems. A heart problem is not only a risk for the heart. Vascular leads to a cerebral vascular accident. I was recently in Brussels, as I told you before. One of my colleagues who knows well how to live his life, but not the Mediterranean way. Meaning he smokes cigars, cigarettes, drinks whiskey, eats good food. Well, he is younger than I am. He had a stroke. Thanks to God, there was no permanent damage, but he dodged a bullet there, to say the least. So the problem is that he has difficulties now to find a supply of quality, that's to say, to change his eating habits. We are familiar with this drawing of the vessels, with the polyphenol and the atherosclerotic plaque. This atherosclerotic plaque, it will clog the carotid artery. Oh, not clogging. We started to study the amount of restriction of the caliber of this carotid, which sends us blood to the brain that allows us to think, make the right choices, and to be stable in our business, in our human relations. So it is certain that the atherosclerotic plaque has no place with us. It has no room in, I don't like to say diet, I say in the Mediterranean diet. Because if you say diet, as I discussed before with my colleague Professor Henri, diet equals restrictions. People after a month, 2 months, 3 months, they say nothing has changed. They get bored. When you forbid them, you won't succeed. You must say, eat better and better. Yum, yum, yum. The 3 Y methods. The Mediterranean method, which is that the sea, the earth, the sun bring you everything you need. We are the countries of the world, the most spoiled at the level of the nutrition quality that our nature gives us, and we do not know enough about it. Today is a great day. I'm happy to be in this conference. I'm extremely pleased that I have met more and more great doctors. I confess that when I got to the amphitheater this afternoon, I wondered how this large amphitheater will be filled. But now it's full. I should say to Ottoman, bravo! You managed to fill it as promised. You know, dear colleagues, sisters, ladies and gentlemen, you know how intensive the public is? How many people start to learn and feel eager to understand what is happening? It's here on the left, the polyphenols. Hydroxytyrosols prevent the free radical to oxidize the LDL. It will prevent it. And then, if you have instead an oxidation of LDL formation of atherosclerosis, the plaque at the level of the heart vessels that go to the brain, but also at the level of the vessels of organs that are important to human life to be responsible for it. Obviously, the vascular restrictions, arthritis, the kidney problems to which will be added to diabetes and everything that follows. We saw that the cardiovascular level, we saw inflammation. I just met one rheumatologist colleague who attended the conference tonight, and I thank her for coming. And you see, it is important to realize in such conferences on nutrition, you meet cardiologists, general practitioners, rheumatologists, and also pediatricians. Yes, I think I saw a pediatrician lady. You see, we are all specialists. As for the inflammation, doesn't anyone in France suffer from backache? Which one? In France, at a certain age, doesn't one have knee troubles? Suffer from shoulder ache? A hip? My orthopedist colleagues asked me to shut up. We have right and left hips prosthesis. We have the right and left knee prosthesis. Let them eat. We now have a shoulder prosthesis. I do not agree with this medicine. I want people to be in good health and be like me. I'm happy 24 hours a day. The effect of polyphenols is clear also on endothelial adhesion molecules, because it is not just that the heart is vascularized, but it may be the kidney, the retina, maybe your eye, your ears. That's why people at the age of 60 or 65 are forced to put death speakers or to go to the ophthalmologist. Hey, I saw an ophthalmologist lady there this evening. As I said before, all specialities are present here, and maybe others that I don't know. It's very interesting. Here's a rheumatology profile, which may be very interesting. It's a natural anti-inflammatory, the olivifors. I will not go to the rheumatologist, or else I will bring him the olivifors to offer it to him and say, "This made me feel good. I will do the same for you." You see the comparison between indomethacin. All the way below, there is a diclofenac, which is a kind of a generic of products most used in rheumatology, in comparison of two others. But you will say, wait, are you trying to cancel the medical prescription and offer me a prescription for a dietary supplement? I will affirmatively reply, I have been battling with the Ministry of Health and Marisol Touraine so that she could understand that a prevention prescription has become necessary. We should prescribe some advice for prevention. I must also include some advice to reduce smoking, to change eating habits and renew the patient. 1 month, 2 months, 4 months, 6 months, 1 year later, to see if our patient really did it and changed his or her habits. But you have to be honest. Our eating habits cannot be changed in one night. It's not easy, especially when one is diabetic. You know well the pancreas is a wonderful organ. In France, I often say to people, have some mercy on your pancreas. Then the people tell me, but doctor, where is our pancreas? It is hidden at the bottom of your belly? It is not quite hidden, but rather protected. It is in such an important place that it is at the bottom of the belly, so it would be in a great risk of damaging by a shot or a car accident. The problem is that we don't know a lot about its functions. We are stupidly damaging it by our bad and poor eating habits. The pancreas has two fundamental functions. Firstly, thanks to it, the blood sugar level is at 1 gram of sugar in the blood. When you eat, for example, a lot of sweets, the rate of sugar increases in the body. Then the pancreas receives a message. It immediately and automatically sends the insulin. And when you have a stoppage of sugar in your blood because you don't take enough sugar, it immediately and automatically sends glucagon, which is a hyperglycemiant hormone. It is a wonder of nature. This is the first action of the pancreas. The second function is that, thanks to the pancreatic fluids, it allows me to digest fats. It is the one who lets us digest the mayonnaise, overcooked things. But if you cook too much barbecue in a regular way, by the way, barbecue is not bad, but be careful to the overcooked fats. The black, which is on meat, the benzopyramidis on fish, these nitrosamines, the pancreas is functioning now well, but one day it will cease to work and will say, "Niet, I can no longer function." These will be the pre-diabetes symptoms which will arise. The immense danger nowadays is a pancreatic cancer. In my point of view, and according to my experience, as I said some days before in Brussels, next to 300 physicians, beware of the excess consummation of dairy. Imagine that the cow is sacred. In the cow products, there are some dangerous growth factors to our health, because we're not calves. In 1 year, veal grows 1 kilo per day. 365 kilos in a year. You and I, when we were kids, we took 5 kilos, no more. Because our mother's milk gave us growth factors for our brain and for our central nervous system, which is, by the way, excellent to recognize daddy, mummy, brothers and sisters, to play and be skillful. In the cow's milk, you will not find the 7 growth factors necessary for the calf's brain, which is a calf brain. Do not forget it. The problem today is that 24 billion liters of milk each year in France are being forced upon us through the holes of our nose, ears, via yogurt. I would personally prescribe yogurt the day before you die. Why? Because you do not have to chew it. It is normal because before you leave, you should have a break. No, one must leave all of that, because we specialists know it. New treatments are, what are they? The anti-factor of growth. On the one hand, we make you eat more growth factors, but on the other hand, we tell you that if you have cancer, we will cure you, and it will be the anti-factor. I want neither of them. As for diabetes, to prevent pancreatic cancer, we know that we would change our eating habits so that the diabetes regulates sugar levels in the blood. Try to avoid eating dairy cows. You can take a small portion of goat or sheep cheese, and since it is very tasteful, you will rapidly be full. Do not forget that everything that has a sweet taste gives us pleasure. This pleasure translates in the fact that we do not come back to that food. If it is tasteless, we keep looking for the taste. These cheeses, we find them in the buttocks of our patients. White cheeses, like the laughing cow. You keep smearing and smearing it until it becomes a catastrophe. You have damaged your pancreas. Therefore, the treatment by the polyphenols of olive oil, you can see 2.5 milligrams per kilo, in comparison to normal patients, will reduce the sugar levels in the plasma, therefore in blood. You will reduce the triglycerine, and you will increase the good cholesterol, HDL.
Du bon cholestérol, le HDL.
The rate of glucose in the plasma of subjects treated by hydroxytyrosol of olive oil decreased by 55% compared to non-diabetic patients, which are not treated with sulfur drugs. Of course, if the person is given insulin at doses where the pancreas is damaged, it is too late. But it is never too late to help a diabetes patient. When I see my colleagues, diabetologists, in France, I ask them this question. When you see a diabetic person, is it a final result? They always answer yes. My response is no. It's true that if there is diabetes for 10 years, it's genetic. It is diabetes type 1. But if it is diabetes of 2 or 3 years, we have to change the eating habits, and we will see great differences. 3 explanations: protecting cells of the pancreas, islet cells of Langerhans, beta cells, which are at the origin of the production of insulin. The hydroxytyrosol can enhance the secretion of insulin by its insulinotropics effects, and finally, it protects it, as I have just said. I repeat, the pancreatic beta cell from damage, death, resulting in increased secretion of insulin, which means that we need to preserve these beta cells. When I say, have mercy on your pancreas, it means do not send it excessive amounts of sugars.
Ça veut dire ne lui envoyez pas des quantités de sucre trop importantes.
In this picture, we have diabetic rabbits. Diabetic rabbits that will be treated and others not treated. Treated rabbits will receive olivifors, your local high-quality olive oil, and you see that there is a gradual decline over several weeks, which shows that this is not to say, I give you a diet for 3 days or 15 days. It means I have to help you change your eating habits permanently. By contrast, there is an increase in the untreated rabbits. Thus, these studies suggest that the olive polyphenols may be useful in the prevention of diabetic complications, such as that of kidneys, retina, and the diabetic foot. We cannot move our feet any longer. We end up at the dermatologist, trying to heal what is not healable. Now, let's move to my speciality, that is cancer. And God knows that it is important to protect and sustain a chemotherapy or radiotherapy, to protect and heal after surgery. On Monday, I had to operate a patient with a rectum cancer. Why does she have a cancer in the rectum? She said she did not eat fruit, except in compote. I advised her to stop that and eat fresh fruits, fresh seasonal fruits, because there are fibers in the orange, the kiwi and the apple. These fibers are made for raking the digestive tract and therefore avoiding constipation, proliferation or putrefaction. Now let's see how the cancer develops. The cell is normal. It has its own DNA and its nucleus. But it can develop to cancer because any cell can become cancerous, with no regards to where it might be located. We need to be aware of the way our body is organized. We doctors know, but we need to pass this on to the patients so that they will respect their body and encourage health behaviors and condemns anti-health deeds. The cancer develops because of tobacco, food with an addiction to sugar, alcohol, marijuana, and hashish. We see young people in France who are addicted to drugs, which can extremely lead to severe immune depressions and cause cancer that prevails in 6 months, when they are only 20 or 25. They get tired from chemotherapy. They do not handle it very well. And this chemotherapy is not effective. So you see, when the cell is tumor, it will multiply and multiply. We will see an apoptosis, and I remind you that I'm unlike my colleagues who say that apoptosis is the suicide of the cells. I do not say that at all. My apoptosis and yours, our natural death, will reach to be 100 years old, and I believe even longer. Moses was 120, and Job 140 years old. Why wouldn't we reach this age? We just need to have good eating patterns, pay attention to what we eat, have good physical activity and good brain activity to avoid heading to this malignancy, to this progression after promotion. So here's the very interesting anti-cancer effect of the polyphenols in olive oil. Able to stop the cell cycle in these phases, you know, GO, G1, S, G2, mitosis, with its different phases, by inducing the expression of very special proteins, which are often found in the liver. Cytochromes, you know how many there are, 350, 250. I cannot tell you how I know how many cells. My colleague Professor Benlemni knows more than I do, and I thank him for having prepared this conference with me. So, the hydroxytyrosol can block the cell cycle. It may inhibit breast cancer. It may inhibit the HERN2, which is an oncogene. And you know that we look for this oncogene in breast tumors. When a triple-negative woman comes to us, what is triple-negative? Triple-negative means she has estrogen receptors and progesterone that are saturated. This means she does not have this integer HERN2, so we do not have the ability to deal effectively with triple negatives that are more serious. We have to know that in the olive oil, thanks to the polyphenol, you have an anti-HERN2, an anti-oncogene. Therefore, taking this olive oil is like taking an anti-cancer in a natural way, particularly that which contains high levels of polyphenols. You can also have the inhibition of the CDK6, which is a protein which activates cell division, and the inhibition of the fatty acid synthase, which plant the cancer in the MCF cells, which are cells of breast cancer well known in cell cultures, or the CKBR3, which is also a tumor that can be studied in vitro. This slide is magnificent because it reminds me of what was presented last Sunday when my colleague Professor Serrarini showed the danger of GMOs among animals infected with tumors. You either have a disappearance of tumors which disperse when there are many, or a unique tumor. You have the first day, as well as the 12th day. Well, with the anti-cancer, the hydroxytyrosol in particular, anti-cancer not in the sense of a chemical molecule that you're going to take in a capsule at a pharmacy, but rather meaning that you will have it in a diet, resulting in the disappearance of dispersed tumor at the 9th day of the unique tumor. We should be aware that rotology is not homology. We cannot immediately transfer all that happens in the rat to humans. However, it is very interesting to know what happens in tumor-bearing animals. Here, for example, in vitro, oncologists know MCF7 cells of breast cancer in vitro. You see that we have 25 micrograms of hydroxytyrosol with oleuropein, 100 micrograms per milliliter. We will block the cells in G0 phase of G1 that will develop into a more active phase and will thus produce the number of cancer cells that may be dangerous and therefore create a cellular multiplication, which we do not wish for the patient. Chemopreventive power against cancer through high antioxidant activity. I am often asked this question in France. Doctor, can I take antioxidants during chemotherapy? Chemotherapy is oxidizing. But what matters is that it is oxidizing to the cancerous tumor. The patient who has breast cancer tells you, "But, doctor, I have breast cancer, and you made me lose my hair. I do not have scalp cancer. There is a fault, doctor." Yes, there is a fault, because the anti-methotic we give them kills all the cells that try to multiply. We do not have cancer of the white blood cells when there is cancer of the prostate, breast or elsewhere, and yet it kills white blood cells, because the chemo does not differentiate between the cancer cell or a normal cell. I remind you that the white blood cell lives 7 days. If it lives for 3 weeks, that is leukemia. A red blood cell lives 120 days, after which apoptosis, which is a natural death, and is replaced by another. A very interesting example. You are 50 years old. Your liver has recreated itself 50 times. The liver renews itself every year. I'm 67, and because I don't drink alcohol, I do not smoke, I have health behavior. My liver is 67. Not at all. It renews every year. It is very important to understand this because it denotes that it is possible to change because our body itself lives in permanence with change. An effect that is an antimicrobial. Also very interesting. Look, it's not an antibiotic effect. There are antibiotics and antimicrobial effects, a very interesting effect. Let's take a disease you pediatricians are familiar with, and which is very annoying. Cystic fibrosis. Cystic fibrosis is a genetic disease which may lead to kids to die after 20 or 22 years from respiratory infections, which forces transplanting 1 or 2 lungs. The child dies because he is infected and his immune system does not work to provide lung protection, because the germs will invade the lung and there will be no immunological capacity to react and neutralize the germ. These are children who must be fed with the oil that contains the potency of these extremely concentrated polyphenols. This is a very important concept. You see these germs? Escherichia coli? Candida albicans? We have these bacteria in our digestive system, but they must be in balance. And you know, today there is a huge progress on digestive flora, intestinal flora. I do not agree when they say the gut is our second brain. The intestine is essential for our brain to block, through intestinal porosity, products or germs which we do not need in the liver, kidney or urine. Let's move to a disease that frightens us, dementia, which is called Alzheimer's disease. But you can add to the Alzheimer's disease Parkinson's disease. I don't know if there are neurologists in this room, but what struck me in France, and that it must be targeted with humor. We are here to learn from each other, so I often ask, I would not like to have Alzheimer's or Parkinson's because I am scared, and I can no longer operate. So what is the first sign of Parkinson's and Alzheimer's? Their response is, Alzheimer is when the memory, for example, becomes thin. Where did I put my keys? Where did I put my raincoat? What did I do 10 minutes ago? Well, no, this is not true. It is not the first sign. What is the first sign of Parkinson's? They say the shakes. But it is not true, it is not at all the first sign. For us doctors, the first sign is anosmia. What is anosmia? It's been no longer able to smell properly. That is to say, if there is a lavender, you do not smell it. If there is thyme or rosemary, you do not smell it. We give you mint. You do not smell mint. You buy your wife a rose. You want to smell the rose, to give her a good one. You smell. It does not smell like a rose. So, you want to find a good rose. You ask for an organic rose. The florist tells you, it is there. You go there. You do not smell, and oh Lord, this is the beginning of Alzheimer's, and it amuses me. Why? Because we can retrain the ability to smell. It was not long ago when I was in a department in the south of France, and I met a huge auditorium of people who were in nursing homes. I explained to them that the smell is very important, etc. The next day, the organizers called me. They told me that all the people are in the Scrabblin, sniffing thyme and rosemary. I say, it's good, they got it. Well, we should smell this olive oil. We must stimulate the smaller parts, which are thinner than hair. Which are at the base of the brain and at the base of the nose, which go out to the olfactory lobes. The olfactory lobes are the first to get affected in Alzheimer's disease and Parkinson's. In Alzheimer's, you forget the smells. We gave you chocolate. We give you chocolate, for example, and you say no to it. It smells different. It's like an impossibility to recognize. In Parkinson's, it is really impossible to identify the odor. No smell.
aucune odeur.
So that's important. We know we can recede the Alzheimer's for 5 years by a rehabilitation of smell.
Une rééducation de l'odorat, ça vaut quand même la peine. Alors, regardez l'effet des
Look at the effect of polyphenols of this fantastic olive oil on Alzheimer's disease.
Hydroxytyrosol,
Hydroxytyrosol will be an antioxidant element at my neurons level.
oxydation au niveau de mes neurones.
I was in the first year of medical school. You would tell me that it is the last century. Okay, it was in 1967. I had one of our teachers who started a course on the nervous system and cells of the nervous system. And I was, like my friends, 17 or 18 years old. He told us, "My dear children, you are 17, 18 years old now. In 3 years, you will lose 20 to 30,000 neurons a day." I looked at him and thought, he does not have many neurons left. But I did not say that as we were leaving. I told him, "Teacher, I am frugal by nature, and you say we will lose neurons which I do not want to lose? What can I do?" He said, "Dear, you will lose them anyways." But who said this? It was Raymond y Cajal in Madrid, who had the Nobel Prize in 1906. I went to check, and it was true. He won the Nobel Prize in 1906 for this reason and another, which was more accurate. But today he would have failed the first year of med school in Casablanca, Montpellier, Rabat, and Fez, or anywhere, because he was wrong. We are able to multiply the neural connections and even neurons. That's why we have to nourish neurons, and you have everything you need. We must get them to work. Work means we should return to poems. It means that we can return to crosswords, reading, not TV. TV puts you to sleep. When I was recently in consultation last week, I often do this because it amuses me. I ask the couple, "Mr. and Mrs., what film did you see yesterday on Channel 2, Channel 6, or Channel 5? She turns to her husband and tells him, "Dear, what was the film we saw yesterday?" They cannot remember it. And finally they searched and remembered. So it's a thriller. And who was the murderer? And she told me, "Doctor, excuse us, we fell asleep watching the movie." So it was an anesthetic effect. TV is a disaster, except when passing messages of good health. And that's why I'm looking at all costs in France to get these messages. Because you see, the hydroxytyrosol molecule is small, and it passes the blood-brain barrier. It arrives at my neurons. It will be the only antioxidant that can cross the barrier to protect my brain cells. So you understand that I will regularly prescribe it to my patients, my colleagues in the whole world, because it is an economy of health. So, yes, it has an anti-aging effect, and what is interesting here is the presentation of the hydroxytyrosol compared to premature aging. Today in Europe, people in train stations, airports, you do not ask about their age, but when they are 50 and look as if they are 60, they are 60, and look as if they are 80. By contrast, you can ask people who are 80 and appear to be in great shape. So you ask about what they eat. Mediterranean. There is olive oil, lemon, fruits, vegetables. There aren't too many dairy products. There is white meat. There is plenty of fish. Omega-3 for the brain. So yes, it is an anti-aging agent that is undeniably useful for preventing diseases related to age. In France, we expect 2 million Alzheimer's. This will cost too much. We need to reduce it by preventing eating habits so as not to have 2 million, but not more than what we already have. 800,000, which is too many. You know that anti-aging is increasingly being used. Today, there are sums of money that are invested in research to prevent it precisely. So we talk about rats that were treated with hydroxytyrosol, with resveratrol. Red wine or white wine? Yes, a little wine. For those who can, no problem. Ester hydroxytyrosol? Ester hydroxytyrosol